Hi, my name is Miranda Spear, and I'll be talking to you today about telehealth. Telehealth has been evolving and transforming its role in healthcare by providing patients with convenient, cost effective, and timely access to medical professionals. So, what is telehealth anyway? The American Medical Association defines telehealth as a two-way, real time, interactive communication between a patient and provider with the use of telecommunication equipment. This became increasingly popular during the COVID 19 pandemic when individuals were not able to go and physically be in person for those um, doctor's visits. The value was also found during this time, and so the popularity has continued to grow. Um, Telehealth also provides higher quality care to rural areas through e visits and remote patient monitoring. Um, with the implementation of using telehealth versus regular office visits, the issue of transportation has been minimized. Individuals who do not drive or are unable to commute long distance for doctor's appointments don't have that concern anymore. They're able to either meet with their provider through things like a tablet or their phone. I know some communities, some smaller rural communities, where the patients will actually go to the hospital or clinic, and at that clinic, they will then be connected with the specialist wherever that specialist might be located, whether it's Sioux Falls or up in Rochester at the Mayo Clinic, but they're able to have that visit right there in their own communities. Um, so, along with that, so these rural hospitals and clinics are able to collaborate with specialists in real time. They're able to show their patient to the cardiologist who is across the state and get their opinion. This can help to manage some of those chronic health conditions right there in local communities. Um, Another thing is that providers can monitor their patients remotely. So there are devices that can be used at home as well to keep them in the home, so they're not having to travel back and forth for doctor's visits. Beyond its role in healthcare delivery, telehealth also brings significant financial benefits to its patients and the communities. Since, like, as I stated, they're able to remotely monitor their patients. So abnormalities in any trends are going to be caught quicker than the patient waiting until they don't feel well and going to the ER. Some things are caught in real time so that the providers can then call the patient and say, hey, you need to go do this, or have some kind of medication management where it can be addressed right away. The visits are cheaper. So a virtual visit is going to be cheaper than your regular office visit. It's shown to save around $19 to $121 per visit. As we already spoke about it, but the decrease in transportation costs as well, not having to travel long distances or to or from, as well as missing any work to attend these doctor's appointments. Sometimes going to doctor's appointments can be an all day ordeal. So being able to meet with your provider over your lunch break or something from your phone is so much more convenient for people. Hospitals are able to decrease staffing wages because if there's less people in the hospitals, they're not going to need that staffing as much. And then lastly, the local collaboration with lab and pharmacies will increase revenue for them as well. The success of telehealth depends on key technologies that enable remote healthcare activities. Um, so, as I have been talking about, the remote patient monitoring devices. So, these are all devices that collect data and transmit it to providers in real time. Examples of this can be like weight scales, just to monitor those daily weights if an individual has congestive heart failure, um, pulse oximeters to measure oxygen saturation levels and heart rate, glucometer to monitor blood sugars and any trends in highs or lows, blood pressure monitor daily blood pressures, and they even have devices that can track baby while an individual is pregnant as well. Another service under the telehealth umbrella is telecare, which is like a monitoring service for elderly and disabled individuals. This can help them increase their independence and safety in their own homes. So, some tools in this category include things like pill reminders or even lock boxes. They can be set up by a nurse, and then when it's time for the patient to take their medication, that box will open and won't be locked anymore. That way, the individual isn't getting too much medication and they know if they took their meds or not. There's also pendants that people can wear or bracelets. Things like Life Alert are pretty commonly heard of, where if the individual were to fall, they could push that button and it would go to emergency services to get help. They also have things such as movement detectors as well that can detect like a fall, or they can detect if someone hasn't been moving for an extended period of time. There is also telebehavioral health. So this is really a new service that's being pushed out to expand access to mental health services in the underserved areas. Mental health hasn't had the huge push as it has had, especially since the pandemic. I think people have really realized how that isolation affected people so much. So getting resources out to those rural areas is so important. As telehealth continues to develop, emerging innovations in telemedicine equipment will further enhance healthcare accessibility and efficiency. So, some of the general equipment needed would be like a high def camera. There are like otoscopes that you can use that would look into people's ears, or you can use them to even look in people's nose. Dermatoscope, which can identify skin diseases and lesions, and your provider is able to look at all those from far away. So that's pretty interesting to me. Also, a lot of the telehealth equipment is what I mentioned before with the glucometers, pulse oximeters, and things like that. My facility I work at as a nurse uses a big screen, so it looks like a big TV, and then the provider comes on the screen and they're able to see through the webcam the patient. Then have these little tools that connect to the screen that can help the physician on the other end assess the patient. It's really interesting. So we have one that we move around, and you move it around on the chest, and it tells you the locations to place it. But then with the use of that device, the provider is able to listen to their lung sounds, breath sounds, heart sounds. They're able to hear what we are hearing on our end to make sure that they are making the best medical calls for that patient. Other tools that come with it is like a tongue depressor. So the nurse is helping the patient at this time. So then they would place the tongue depressor into the mouth, and then the provider on the other end is able to assess the throat and things like that. So it's really interesting how technology really has helped us in healthcare. There are also mobile apps for symptom tracking for people that can help with those trends and identify if, oh, maybe it's time they go see their provider, things aren't trending in the right direction, maybe a medicine change is needed. Mobile apps can also be educational resources for patients, can provide them dietary information or information about their medications that they're on, or when they should be calling their provider, depending on their specific chronic health condition. Future trends move toward technology such as AI assisted diagnostics to increase efficiency and natural language processing for automated note taking. So I think that AI itself is a little scary, so that makes anyone nervous. But as far as note taking and things like that, I've already seen a lot of providers roll out the recording devices to basically do their dictation for them. And they've said that it is increasing the efficiency and of the doctor's note taking, and less stuff is forgotten from the time the doctor leaves the room to when they go to their computer to document. So, in conclusion, telehealth is a powerful tool in modern healthcare, but the future success depends on a balance between virtual and in person visits. The future of telehealth will continue to bridge gaps in healthcare as well for individuals. Thank you so much.